Okay, about the inguinal hernia and the hydrocele station, both of the station is pretty similar. Okay, here we are going to have a real patient and the patient positioning will be standing. So we need to uncover the patient from the umbilicus to the patient foot, right? So we are exposing the patient's genitalia. So we need to ask for the chaperone for the patient. Okay, very important. Okay, so now,
Excuse me, sir. How will
yes,
we ask for the chevron, sir? Can you
we
please?
simply ask towards the examiner that I need a chaperone for this patient. Okay, and the examiner will mention, okay, consider it done, or I will act as a chaperone, or there will be an assistant for you who will act as a chaperone for you. All right. Next.
Okay,
So
sir. Okay.
about this station, I will start the station while I will be just simply washing my hand. The very first place, I will enter into the station with a nice greet, good morning, with a very smile, my smiley face, and then I will mention, hello, I'm Dr. Mohammad Atikul Islam, one of the exam candidate for today. May I confirm your name and age, please? And then after that, taking the name and age, I will ask, okay, now today I have been asked to examine your private parts or the genitalia. It will be including the looking, feeling, and some special tests, and also some of the hearing as well. Is that all right for you? And do you have any kind of pain is there or not? Okay. After that, always remember for the swelling or for the any kind of lump, we have to go for the 6S, right? So for the 6S, we are going to check about the side, okay, whether it is right side or on the left side, about the shape, what is, if it is a piriform shape or it is oval in shape or it is round in shape. And then also we have to check whether there is a surface or whatever the surface about the scars, okay, and also is the skin overlying. So all of these 6S's we are going to check. Then we are going to ask the patient, can you look on the opposite side and you cough for me? So we are going to check about the cough impulse. Okay. After this, our inspection is done. We have to go for the palpation right now. Suppose we are thinking the patient is having a right-sided, maybe the inguinal hernia. Okay. So we have to start with our, first of all, for the swelling, right? For the swelling, what we do, we have to go for the, first of all, the temperature of the swelling, over the swelling. Okay. What about the temperature? Okay. Next point, we are going to palpate for the tenderness. We are going to look over the patient face for the tenderness as well. Okay. Then after that, we are going to check over the surface. Okay. Then we are going to check about the swelling, whether it is mobile or not, it is reducible or not. Okay. Then after that, we are going to check whether it is pulsatile or not. Again, we are going to hold and we'll ask the patient, can you look on the opposite side and please cough for me? So we are going to hold over that area and we're going to check the cough impulse again. Okay. After that, we have to check by our both hand over this area and we want to check whether we can get above the swelling or not. If we cannot get above the swelling, which means this is what? This is
Hernia.
hernia. If we can
Hernia.
get above the swelling, which means this is a hydrocele. Right. Next point is we want to check the testis on the both sides whether it is separated or not. If it is separated, that means it is
Hernia.
what?
Hernia,
Hernia.
Hernia.
And if it is not separated, this is
hydrocele,
hydrocele. Very nice.
hydrocele.
And then after that, we will ask or we will try to reduce the swelling by ourselves. If we cannot reduce the swelling by ourselves, then we will ask the patient, can you please reduce the swelling by yourself? At this point, the patient will able to reduce the swelling by himself. Okay. While the patient is standing, if the patient is cannot able to reduce the swelling while standing, then in that case only we'll ask the patient to lie down and reduce the swelling by himself only. And then if the patient cannot reduce the swelling by himself, then we will try to reduce again. All right. So first of all, we will ask the patient to reduce the swelling by himself while the patient is standing. It's not happening, then we will ask the patient to lie down and reduce by himself. Not possible, then we will try to go and reduce the swelling by ourselves. Okay. After the patient has reduced the swelling by himself, we need to do a special test. This is known as deep ring occlusion test. Okay. So about the deep ring occlusion test, after the patient has reduced the swelling himself and while the patient is standing, okay, so the patient has reduced the swelling. Okay. So we need to occlude the deep ring. So where is the deep ring is located, guys? It is 1.25 centimeter above the midpoint of the inguinal ligament. So about the inguinal ligament, it is from the anterior superior iliac spine to the pubic tubercle. Okay, so we will go 1.25 centimeter above to this point, and we are going to occlude this area after the patient has reduced the swelling, right? And then we will ask the patient to cough. So we are going to ask the patient to cough, and we are going to observe. So can you please cough? Yes. So we are observing whether the swelling has come out or not. If it is not coming out, which means it is
Indirect.
indirect inguinal hernia. Okay. Next point, what we can do, through the scrotum, we can put our fingers through the deep ring, and after reducing the swelling, if we can occlude this area, and we ask the patient to cough, and if we can see the swelling is coming out, okay, which means it is direct inguinal hernia. And if it is not coming after occlusion, the deep ring, it is indirect inguinal hernia. It will be hitting our tip of our fingers in case of the indirect, and in case of our direct